My name is Jarrod Hindman. I am the Vice President of Community Development at LivingWorks.
I'm Alex Yannicone. I work for the CU Johnson Depression Center as the Director of Education and Community Programs. We do a variety of trainings and education opportunities ranging anywhere from self-care to stress management to suicide prevention. We have the program Working Minds, which is suicide prevention specifically within the workplace.
Thanks, Jarrod and Alex. Hi, everybody. I'm Sally Spencer-Thomas, and Dr. Jody Jacobson-Fry and I co-chair the Workplace Suicide Prevention Committee for the American Association of Suicidology. AAS is one of 3 national partners supporting the Workplace Suicide Prevention Guidelines in a collaborative partnership along with the American Foundation for Suicide Prevention and United Suicide Survivors International. Our goals today for this webinar are, number 1, to make the argument that workplace training is a critical component of an overall comprehensive and sustained strategy for suicide prevention in the workplace. And then we're going to give you a little bit about what to look for or how to build a training program, and to really think of it as a tiered program, kind of along the lines of CPR. We have a basic training that everybody gets and they get redosed often. You have an advanced training for a smaller group of people, like an EMT level. And then you've got advanced specialists that focus on doing the high level work. So that's where we're headed. We have 8 guiding principles in workplace suicide prevention, and I encourage you to go to workplacesuicideprevention.com to get more information about these 8 principles. But the ones we're going to focus on today are really about action orientation and comprehensive and sustained work. It's not good enough, as we'll hear, just to do a one-off training and figure that you're done, or just to do awareness work that doesn't actually get people involved. And then of the 9 practices, again, if you want more information, visit workplacesuicideprevention.com. Of these 9 practices, obviously today we'll be talking about training. Back to you, Jarrod.
And so when I think sometimes about workplaces and suicide prevention, we sometimes land on, well, let's train our EAP providers, and let's train the human resources folks, and let's train the social workers if we have them. And the reality is these data really tell us that we need to go above and beyond that. And intuitively, I think we know that because our data also tells us that the people most impacted by suicide, who die by suicide the most, are the people that don't really engage with those resources, typically in their workplaces or in their day-to-day lives. And so this concept of comprehensive, including training across a workplace and across a community, is really important. So we need to be thoughtful about that as we plan. When we look at the public health approach to suicide prevention, and at LivingWorks, we've really embraced this concept of taking a community-based, what we call a network of safety approach to suicide prevention. We've done a pretty good job of training crisis services and healthcare providers, and we've really emphasized suicide prevention among school populations, for example. But if we really want to provide a community-wide comprehensive approach, and we want to reach people most impacted by suicide in a meaningful way, workplaces are absolutely critical places to teach, to raise awareness that suicide prevention is a priority, and to develop skills and to create opportunities for people in need of help to get the help that they need. And workplaces are built for that. The challenge has been that we have not systematized it or adopted it more broadly culturally in workplaces. And so the important component of workplace suicide prevention is that corporate social responsibility, right? So not only are you training your workforce to be good workers, but when they show up at home and they can provide those skills in their neighborhoods or with their family, these are translatable skills and awareness components that really help build that comprehensive approach. So it's bigger than just the workplace. And I think as we do workplace suicide prevention, it's important for us to also think about, should we be training spouses and family members and other community members where we do our work? And I think that's something that we should think about. At LivingWorks, what we call them is safety starters. Teach people basic skills to understand how to support themselves or somebody else, and get them connected to the organizational resources or the community resources that will support them to show up as better workers. And when you create environments where wellness is adopted and a part of the system, that also creates a protective environment where people know that wellness is a priority and that mental health and suicide prevention is part of that priority. And Alex is going to talk about what a tiered system works like.
So yeah, I'm going to talk a little bit more now in the what of what makes a training successful. And there's a lot of elements that go into this, but just a few to highlight is that tiered approach. So we want to train all levels really to build this safety net. So we want everybody at an organization to get some level of training, but we also want to create layers of expertise by maybe providing more advanced training or more in-depth training for leadership or supervisors for that added support. And yet we do see, though, there is trainings across all levels. It's just going to look a little different depending on how the organization of the company and what roles each person may play. We also want to go just beyond awareness. There's something to providing information and giving out resources, but with training, we really want to dive a little bit deeper. And part of that is having some skill building. So we use a model a lot of times and where we instruct and we give that information. We then as trainers provide the opportunity to model what that can look like and then have the participants really be able to practice it and provide them feedback. That opportunity to role play and have group discussions and really bringing it into their organization, really bringing in their experiences, their culture, really builds a more successful and impactful training. It's also ideal to offer or to have the ability to do train the trainer. We see that systems that train their own people to be trainers, it's one going to be more sustainable. I think it also helps with understanding their company, their culture, their employees a little bit more and what makes sense for them. I think we all know that with suicide prevention, a lot of the information can be overwhelming, and especially for people who aren't experts in the field, this feels really heavy. And so when we're able to give them the opportunity to understand there is a lot of hope, there is recovery, there's a lot that we can do, that makes that training a lot more powerful for those who are attending. And follow-up is also really important, where we are offering this over time and repeatedly. So just doing a one-off training and never checking back in on it obviously doesn't give us much opportunity to know what is utilized or what was successful. So having check-ins and continuous training really helps bring the content and skills to the front of the mind. It also helps build confidence. And it's also great for evaluation over time, not just seeing if they like the training, but seeing if there was any long-term impact. So one quick example of industry and a company that really has utilized this is RK Construction. They're actually based in Colorado. They have over 1,500 employees, and they've really been regarded as a model for suicide prevention in the construction industry. They take a really multi-system approach to addressing mental wellness. They do have 24-hour access to counseling. They do weekly toolbox talks that highlight mental health. And then they even have trainings for all different levels of their employees as well. Their COO, John Kinning, really has been an advocate for mental health since the start. They provide the Working Minds training within their industry, and for every training, he is in attendance. He really shows that this is important not only to him, but to the company as a whole by showing up and being present for those trainings. And he's actually even stated that he believes they've averted around 15 suicides since 2014 due to their education, their awareness, and their approach around this. And here's just some information. They've been highlighted a lot in what they do. 9 News did a coverage on them not too long ago. In December, NPR actually highlighted them as well. So if you're wanting to learn more of kind of what their approach is and how they've addressed this, they are a good example. Just some action steps and resources to note in terms of training. One is just to start the conversation. I think this is important to first off, listen to what people are wanting, what they're needing, and being able to fill those gaps. doing assessments of mental health and where people are and what access and services you are to get them that education or training they may be needing. It's also important, once we kind of recognize where we're needing to focus, is do your research, figure out what programs would be a best fit for your organization or your industry. The Suicide Prevention Resource Center is an outlet to kind of check what there is. We'll also put up some slides here in a little bit that highlight that as well. Reach out to organizations or to programs or training opportunities to learn more. I think any training industry is really willing to teach you more or to be able to provide further information that may help you in recognizing, is this a good fit? And then obviously schedule a training and see how it goes, get feedback and move forward and seeing how important a training really can be for your organization. And then here's just some resources that may be helpful. There's some workplace trainings, including LivingWorks, QPR, as well as Working Minds. Here's also the case studies to RK and what they've really been doing specifically around trainings, but also what they've done just as addressing mental health as a whole. And so that is all the information that Jarrod and I have in terms of the understanding of training and that tiered approach to it.